Okay, so we move on to panic disorders and the management, which is the most important thing to um to remember. So we have 5 steps: diagnosis, treatment, review, referral. So step one, recognition and diagnosis. Step two, treatment in primary care with cognitive behavioral therapy or medications against sertraline being the first line. Step three is review and consideration of alternative treatments. And step four is review and referral to a specialist mental health services. So the last step is step five, care in specialist mental health services. So the first thing is to recognize and diagnose that the patient has panic disorder. The next thing is to give them to do is psychological intervention, sorry, psychotherapy, which is the talking therapy, which is cognitive behavioral therapy. And if that does not work, we move on to giving you medication, which is sertraline. If that doesn't work, review for alternative treatments. And if the alternative treatment doesn't work, that means you can give another, um, you can either move on to another selective serotonin reuptake inhibitor and see if the patient performs better. Um, you review again, and if it's not working, you refer to a specialist at the mental health services. And if there is a need, they should be cared for in with a specialist as well. Refer to a specialist from primary care. Now, how do we treat? Like we mentioned, CBT medication is SSRIs being the first line. If contraindicated or no response after 12 weeks, you can move to another one, or imipramine or clomipramine should be offered to the patient. So next we have obsessive compulsive disorder. It, from the name itself, there is an obsession and there is a compulsion. And the obsession is they keep having thoughts that keep coming in. Now, one way to remember those who actually deal with this is, if we can remember during COVID-19, there are some who suffer from this who would have been very excited because that was a period where we were constantly told to keep washing our hands. You touch something, you wash your hand. You open the door, you wash your hand. There are some people who suffer from OCD that constantly wash their hand. They shake someone, they touch something. So it is the thoughts that keep coming, unwanted thoughts that keep intruding into their thoughts, telling them to do this, and then they have the compulsion to do it. And usually what happens is what they do, or the intrusive thoughts, is usually something that causes them to repeat the same thing over and over again. So they are going back. If it's those who keep everywhere clean, they keep cleaning even when the place is clean. If it is those who keep washing their hands, they keep washing. So the behavior is actually repeated over and over again. So you have the mild, you have the moderate, and the severe. For the mild cases, again, we have cognitive behavioral therapy, and then you can use the eye movement um, therapy. If that doesn't work, then you move on to the selective serotonin reuptake inhibitors, which is medication. For the moderate, in moderate cases, you have the selective serotonin reuptake inhibitor, you have fluoxetine as another choice, which is also an SSRI. Then you have the CBT, or the eye movement therapy. Then here, if the selective serotonin reuptake inhibitor is contraindicated, then you give clomipramine, which is also important to remember. For severe cases, it is referred to secondary care for mental health assessment. So here is a picture of the washing of the hands of some individuals who actually suffer from OCD.